Hello, welcome, ProfessorRICHRN here. Today I'm going to be showing you this amazing pump, the AutoInfu IV pump. It's a groundbreaking medical device that's revolutionizing infusion treatments. If you're new to this channel, don't forget to hit the like and subscribe button so you never miss the medical news or any nursing updates that I might have for you. So let's get into some details about this AutoInfu IV pump. This device here is a game changer in the infusion game. So it can be used in medicine, surgery, pediatrics, cardiovascular units, EDs, ICUs, etc. It has built-in 40 different drugs, so you can be very precise with that as well. One of the cool standouts of this pump is its battery. It has a rechargeable lithium battery boasting 14 to 16 hours of standby time. It's a workhorse going over 10 hours if you're gonna make it at a flow rate of about 25 mils per hour. If you're gonna be running something at a higher rate, say like 1200, multiple boluses after one another, that's gonna run for about 4 hours. But the power out, you're not gonna have to worry about any sort of power outages. Alright, so some of the other features that this pump displays are an air bubble detector and some other additional alarms. So of course, safety is paramount in regards to nursing or medicine in general. So this pump is equipped with an ultrasonic air bubble detector that ensures precision with adjustable different levels. The AutoInfu IV pump has a symphony of alarms, from air bubbles to door opening, to ensure patient safety at every step of the way. At any point, it's very intuitive pump to work, but if at any point you're confused, it has a very well-written manual that can assist you as well. So today, I'm gonna go ahead and show you exactly how this pump works in various fashions. First, I'm gonna start by loading the IV set into the pump. Then I'm gonna show you how to run our normal infusions, such as normal saline, LR, how we can program that to specific rates such as 100, 125, etc. I'm also going to show us how to bolus a liter bag of normal saline. I'm going to demonstrate how to use their built-in drug weight calculator and how we can use that to set up a dosage for our patients. Then I'm also going to show you how to use their bolus mode, which is very specific for under 5 milliliters of medications. So let's go ahead and get started. Okay, so now I'm going to show you how to turn on the pump, and then it's going to run through safety checks, and from there we're going to load the IV set. So you're going to go down here to your power button on the bottom. And as you can see, it's doing its self-testing, door, battery, AC power, air sensor, etc., making sure everything is working, and if not, it's going to let us, okay? So now what we're going to do is there's this latch on this gray door over here. You're going to pop that open, and you're going to pull it like so, and it's immediately going to alarm telling us that the door is open. So now I'm going to push in these very gently, okay? All right, last one down here. All right, so now I'm going to open the door, close the door. All right. And now our set is loaded. From here, we're going to input in a normal infusion order. So for an example, we have an infusion order of normal saline set to run at 150 mils per hour, and that is a 1 liter bag. So as you can see right now, it's programmed at 100 mils per hour, so we're going to need to change that. This pump also allows us to change the infusion mode from drops to just for milliliters as well. So if we wanted to change that, we're going to go to the arrows, and here's all your options. So it has select the IV infusion. I pre-selected that already before the video. Then you have your infusion mode, you have your alarm settings, your KVO settings, which is keep vein open, your bolus settings, your drug mode, and then some advanced, okay? So here, I'm going to go down to my infusion mode. I'm going to hit the enter button, and this would allow you to change it from volume mode to drip mode. I want to stay in the volume mode for this example, so I'm going to leave it like that, but all you would do is hit the arrows up and down and hit enter to the one that you wanted. So I'm going to hit the back button over here. And as I mentioned, now what I'm going to do is I'm going to change my rate to 150. So I'm going to hit the enter button here, and I'm going to use my arrows to get where I want, which is 150. Okay, perfect. Then I'm going to hit enter. Now it goes to the next one, And as you can see at the top right here, it has volume to be infused at 1,000. If needed, I could adjust that. Okay, now for this example, I've already primed my tubing. I primed it before I even entered it into the IV set. And I double checked my orders. There's no kinks. I've unlocked all the clamps. So then of course, if everything matches out, your next step is going to be go ahead and hit the start button. And it's gonna go ahead and you're gonna look for some drips right there. And it says right here, volume mode. Looks like we've already infused 0.3 ml, so it seems to be working great. Now what I'm going to demonstrate is how to program this pump to run a bolus. So let's say we have a bolus of normal saline 1 liter, and we have an order to run it at 999. So that's what we're going to do. I've primed my IV tubing, hung up my bag, I've inserted into my IV pump the IV set already. So now I'm just ready to program that pump. So what I want to do is I want to use my arrow keys on this main frame, and I'm going to hit the enter button, which is going to allow me to change things. So I'm going to scroll up. First, I want to change this VTBI, which is volume to be infused. I'm going to set that at 1,000. I'm going to use my numbers here on the keypad. Then I'm going to hit enter, and that's correct. Now I want to hit enter again. I'm going to change my rate that I want this to run at. So what I want this to run at is 999. And then I'm going to go ahead and hit enter. And double check my orders, make sure everything is correct. Then I want to make sure everything is unclamped and it's hooked up to the patient, and I got a working IV. Then I'm going to go ahead and hit my start button, which is up here. And then you just want to monitor your drops here. So the next feature we want to show you is calculating a drug based upon their weight. So again, another very easy to use system that they have set up. So for this example, we're going to use dopamine, and our order for that is 1 microgram per kilogram per minute. Okay, so for that, what you're going to do is you're going to go ahead and hit your menu button. And this is where you can select your different options. So you're going to scroll down until you have the drug mode. Then you're going to hit the enter button. And then you're going to find, it gives you a list of drugs that this pump is compatible with using this mode. So you're going to find the one that you want. So for us, we said the example was the dopamine. So we're going to hit that one. And then again, dopamine comes up. And then we're going to go ahead and hit the arrows down. It's actually already set to micrograms per kilogram per minute. But if it wasn't, then you can adjust it there. And then now we're going to set that dose rate up to 1. So I'm going to hit that and then scroll up to 1. So now we have 1 on the dopamine. So next we're going to hit enter. And then we're going to use our arrows to go down to the body weight. And then we're going to hit enter to allow us to enter the body weight on kilograms. Okay, so once you've entered all that information, the next step for you to go ahead is hit the enter button one last time and go ahead and hit selected. And that's where you want to be. Then you can hit the menu button, take you back to the main user interface, and now you've programmed your pump to run this dopamine drug. So we just went through some of the samples of this pump. We went through the bolus, we went through the drug-based mode, and your volume infusion mode. Those are just a few of the modes. There's also an advanced, there's also keep vein open. So a lot of different options for this pump. So again, this is a great option because it's very portable. You can unhook it, carry it around, and we talked about that long battery life, so it's great in that aspect. It's also very precise and accurate to deliver the best drug to our patients. So highly recommend this AutoInfu IV pump.
Entertainment.